Remarkable, Councillor. Apologies for missing my slot, but I haven't managed the skill of bilocation yet. I was in Leinster House, and the traffic is very heavy, so I ran the last bit. Anyway, I'd be like Ronnie Delaney. I'd be fit for the Olympics. Minister Butler, I have wished you well in your portfolio, and I do wish you well. I know you make efforts, genuine efforts, to try and help with mental health and budgets and in a caring way. And I welcome this move from what we've known as the Central Mental Hospital to Portrent, a new site. And I know it involves the Land Development Agency and whatever, but any moves we can make to try and give some empowerment and some respect and a listening ear to people that have psychotic tendencies or mental health issues is very, very, very welcome. So, I mean, I listened to Deputy McNamara on the way over, and I've listened to him a lot on these issues because he has been consistently, since the start of COVID or since the first months I went to it, looking for data to be collated, and as I have been, but he's far more eloquent and in tune with it than I am. And it's very, very difficult. I know that some of the workers were deemed not being essential workers, and they were taken off for that reason. And other of them were taken off for very important issues and places, and still are. And some very specialist people who, in their own right, do a wonderful job, and the people that they need, young and old. But the services that they were taken away from actually could actually create mental health issues, because, you know what I mean, orthodontic and specialist therapists and all that, they're big issues for adolescents especially. And you know, I was talking to a colleague of mine last night who was aware where a child, a 14-year-old, was in a very, very distressed state in boarding school, and look, that traumatises everybody around him. But the data, as I said, for any information, like trying to get information off NEFIT, is like the first seeker or the third seeker of Fatima. And to try and get information on mental health shouldn't be that difficult. And why have we such a conglomerate in the HSE and the Department of Health that around the house and mind the dresser? That's what it seems to be. Keep the circle going, keep the paper replies going, and most of them are meaningless. And so they even get new adjectives and words. They must have script writers in there that have experience in words that say nothing. Long words that say nothing. And I remember as well, Deputy Mayor referenced it, in the 2011 or 2007 to 11 government, they did ring fence funding in a big blaze of glory, a great aplomb. But when you drill down into it, that money was taken into other parts of the HSE, many other parts of the HSE, and we know best in Tipperary about this. I'm not saying we know better than anybody else, because we lost our long stay beds, one of the hospital institutions of St. Michael's, on the same grounds as St. Joseph's, now named again by a nice dream up by the HSE, South Tipperary General Hospital. Whatever was wrong when we watched under the watchful eye of St. Joseph, I don't know. He looked after many of us and still does, and if I want to appreciate him and pray to him or whatever. But we have to get rid of all this. So we lost it, and we were promised the sun, moon, the stars by Minister Maloney at the time, and I railed against it, and then Minister Kathleen Lynch put it in, had it all together, and we lost our hospital. And we were promised the Rolls Royce of service in the community. Now, I salute the people that are involved in the community teams, but they are unable and not having enough members, enough time or facilities. We're trying to get upgraded works to our crisis house, going on forever. I believe it's starting now, I hope, in the first quarter of next year. But we need long-stay service beds in Tipperary, because the people of South Tipperary, and it's a big area, Councola, have to travel to Kilkenny. People north of the county have to travel to Ennis. And those two places are full already, overfull. And not that they don't want Tipperary people, but they just can't cope with them. In Kilkenny, they cope. They have the southeast region, the Carlow, Kilkenny, and indeed Wexford to look after, as well as Waterford. And then we're, pardon the pun, on the hind tit in Tipperdown. And we don't ever want to be in the hind tit in Tipperdown. We're entitled to our place, a rightful place in the queue of services, for especially people with mental health issues. And Minister, I know you visited us. I met us twice and listened to us. I know you also went and visited the facility in Kilkenny, which was brought to an atrocious court case. Atrocious things happened there because they were understaffed and poorly managed and lack of resources. So that has changed. But you did say something to us that I dispute furiously, and so do all of us, that you found it was under capacity. No, it's not under capacity. It's all the time. My stories are from mental health users, their families, the consultants and the doctors, is that it's almost impossible to get in there. And when you're in, you're not halfway through your treatment and you're out. And there's some awful incidents in Waterford as well, I know that. I read about them, court cases, I heard about them. But I know you got delivered beds recently for Waterford, and rightly so. I don't deny any county. They're all entitled to fair play, but especially vulnerable people. And we need to have our long-stay beds back. And Minister Jim Daly said in the House several times to me and others that we had a deficit of 15 beds in South Tipperary, and we were going to get them. So did HSE officials at meetings. But now, Minister, you're saying a different thing to us. That there's enough, and you won't be getting any beds in Tipperary. That is not going to be accepted. People in Tipperary are entitled to these beds because we have no public transport. You take it from Emily down to Kilkenny's an awful distance, or from Monard, or from the Limerick Junction. There's huge areas, distance. And the other way from North Tip to go up into Ennis is when a loved one or a friend or whatever goes into one of these institutions, they need help. They're down, they're low. But they will recover with the support of the medical services and specialist services. But they also want buddies. And the buddies, I mean family or friends or partners or whoever to support them, to visit them. But they can't visit them in Kilkenny. They have to get a taxi out from the bus station out to the hospital in St. Luke's, adjacent St. Luke's, and it's just not possible. And then the enormous amount of money that's put in, costing the Gardaí with Garda cars, bringing people who have, whether they go involuntary or involuntary, to be transferred to Kilkenny. It's unbelievable. And an enormous amount of time and cost and waste of time of the consultants travelling to and fro from Tipperary to Kilkenny and from Tipperary to Ennis. So there's huge waste in the system. And I'm appealing to you, Minister, this evening, as we're bringing this out and shaking up the, and shining a light on the mental health services here and the facilities in Portrane. But we need to deal with the waste. We did at the part of the Rolls-Royce model was a taxi service. There were 2 or 3 taxis hired. And then there was a row with the P&A nurses because they wanted, if it was an involuntary case, I think they wanted 3 nurses. And next one Friday evening about 6 o'clock, one of the providers rang me. He got an email at 5:20. Services no longer required. So you either walk, cry or run or swim to Kilkenny or get a Garda cab, but you can't get transport. So there's huge deficiencies. And that is unfair to these people. After all, they're our siblings, our friends, our family, our community people, and they need those services, and they have to get them. So I'm appealing to you, Minister, along with what you're doing here in Portrane, along with the compassionate attitude you have, to ensure that beds are put back to Clonmel, long-stay beds. We're not looking for them forever, but when they're there, people need it a couple of weeks or a month maybe, they need them. The crisis house is fine, but it's small, it needs to be extended, and the community teams their work will be easier then because they'll have a continuity and they will have a place to treat them if they have to be treated. So it's very, very serious, as I said, and the pressures that COVID have now added on top of even the students. And 6-year students, I had one myself last year, and she's, thank God, she's a wonderful girl, but it was so difficult for them, the uncertainty. And the students now that are in college and sent home to work from home, and the families trying to scrape up the money, and they did do it for the first semester. Now they're getting calls in the mail for the next semester, and they're not living there. So they're living at home, and you have to use all the facilities at home, and they're not able to use the facilities in college. So all those pressures, the pressures now that are on business people, when the business have been shut by diktats from the government. It's draconian measures, I call them, by any account. We're the best country in Europe, we're told regularly by the Minister, with managing COVID. Guess we're the most severe restrictions. What's been done to the publicans? What's been done to the hairdressers? What's been done to the dancing teachers? Thank God we're fighting to get them back, and they are slowly getting back. But it's nothing short of a tyranny. And the sweeping powers, and it's going to go on until next July. We wanted a review in February, we didn't get it. So, I mean, and the pressures, the moratorium in the banks was lifted to let them ride in to the Wild West, all guns blazing, terrorising people. That's what they're doing. I mean, if state institutions terrorising people, not state institutions, but institutions that are supported by the state. We almost own one of the banks, and they're doing that to people, and they shouldn't be doing it to them. So I'm appealing to your better judgment and your kind disposition to try and empathise with these people. I'm not an expert on it, but I know that my late mother was in St. Michael's and she availed of it, and many other people did. And it was a wonderful institution. And Minister Lynch, I'll never forgive her, she said it was set in stone, written in blood, that they couldn't to be closed. Now you've spent 1.9 million on it, upgrading for COVID, and you tell us it's suitable for when COVID is gone, we're hoping to be gone, that it won't be suitable for any mental health patients. That's kind of not unjoined up thinking and disgraceful and wasteful spending. That shouldn't be allowed to go on. So I wish you well with this project here today. I thank the Controller for allowing me in because I could have missed my slot, and I look forward to your answers. Good morning.